Welcome to our audio guide. This recording will introduce you to the Aniball INCO medical device and walk you through how to use the balloon properly. The Aniball INCO balloon is a medical device designed for the prevention and treatment of stress urinary incontinence. It helps train conscious relaxation and contraction of the pelvic floor muscles. It supports pelvic floor awareness and shows you how to work with it through breath, not only strengthening but also relaxing it to keep everything in healthy balance. We want to create a calm, comfortable atmosphere for your regular training, so please read the manual carefully before your first use. Before we begin, let's go over a few important safety notes related to your training. Check the balloon's integrity and function before each use. Wash or disinfect the balloon before each session. Have everything you need ready: the INCO balloon, towel or small pillow, and optionally some lubricant gel. Ideally, you should practice 4 times a week for at least 5 minutes. Daily is even better, and always with an empty bladder. Never train through pain or exhaustion. Listen to your body. To avoid injury, the balloon shouldn't slip out too quickly. Hold it gently in place during exercise. If you're using Aniball INCO after childbirth, start only after your postpartum healing period and after any birth injuries have healed. Let's gently prepare together for the start of your practice. Find a quiet place where you feel safe and comfortable. Lie down on your back. You may want to close your eyes, feel the natural rhythm of your breath, and tune into the present moment. Close your eyes and breathe in slowly and deeply through your nose, down into your lower belly. Place your hands on your abdomen. It shouldn't puff up too much, but you should feel that you're intentionally sending breath into it. Breathe in and out deeply and fully at least 5 times. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Your pelvic floor moves with your breath. It relaxes on the inhale and contracts on the exhale. Don't rush, just feel your body. There's no need to control or change your breathing. Simply connect with its natural rhythm. Let your breath flow freely, don't hold it. Holding your breath can cause unwanted tension, so it's important to breathe deeply and smoothly, even while inserting the balloon. Are you synced with your breath now? Great. Proper breathing is the best foundation for full relaxation and smooth insertion of the balloon. The ideal position for practice is lying on your back. If your legs are still straight, bend your knees and place your feet on the floor. Your legs should be about hip width apart, and make sure your head isn't tilted back. Use a thin pillow if needed. Inserting the balloon. Take your time with insertion. If needed, moisten the balloon with some lubricant gel. Inflate the balloon with 1 or 2 squeezes of the pump. Hold the plastic neck and gently insert into the vagina. If the balloon slips out with each inhale, give it a slight extra pump. It shouldn't cause pain. But to be effective, you should feel a mild resistance. You can always deflate it during training to a more comfortable size. As you breathe, the pelvic floor contracts and releases, causing the balloon to move slightly inside you, deeper in or closer to the opening, giving you a clearer sense of how your pelvic floor muscles work and what sensations are involved. But remember, never push through pain or exhaustion. If you feel pressure or tension in your lower abdomen, pause or stop completely. Gently remove the balloon, deflate it to the smallest size, inhale to relax your pelvic floor, take it by the neck and slowly pull it out. Training phase. Working with breath. Find a comfortable position. Place your hands gently on your lower abdomen and take a deep breath in. Send your breath into your belly. Imagine directing it straight into your hands. At first, observe how your pelvic floor muscle relaxes on the inhale and contracts on the exhale. During the inhale, learn to consciously release your pelvic floor muscles. With the exhale, gently squeeze the balloon and move it slightly inward. Picture your vaginal walls hugging the balloon. Don't tense your belly, buttocks or sphincters. Keep them relaxed. Try repeating this for at least 5 times. And once you feel comfortable, aim for 10 repetitions. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. And exhale. Feeling some pelvic floor fatigue after the first few sessions is completely normal. That's a sign you're using the right muscles. But if the fatigue is so strong that you can't activate the muscles anymore, stop. Remove the balloon carefully and give yourself time to rest. Lie slowly on your side. Let your breath flow naturally and relax your whole body. No more clenching. Imagine your pelvic floor expanding outwards in all directions. After a few days, the fatigue will ease and you'll be able to move into the second and third training phases more smoothly, without needing rest in between. Training phase, lengthening the contraction. Breathe deeply and steadily into your belly. Just like in the first phase, relax the pelvic floor as you inhale, but this time, with every exhale, hold the balloon in place for 10 seconds. While holding, either take a long exhale or inhale and exhale again, but try to keep the squeeze the entire time. Repeat 5 to 10 times. Inhale. Exhale. Inhale. Exhale. Activating the pelvic floor muscles consciously might feel tricky at first, but don't give up. Let's move on to the next step. Training phase, resisting increased pressure. In this phase, focus on squeezing the balloon not only during the exhale but also during the inhale. Gently place your hands on your lower belly and take a deep breath. Send your breath into your belly, straight into your hands. Try squeezing the balloon and holding the contraction for around 10 seconds during the inhale. As you exhale, don't release. Keep squeezing with your pelvic floor. Let's try again. A deep breath through the nose, steady and full. Squeeze the balloon during the inhale and keep holding for 10 seconds. Exhale slowly, keep the contraction going. Repeat this 3 more times. A long, deep breath into your belly while keeping the balloon firmly held. Then exhale, still squeezing, your pelvic floor stays engaged. At the end of the training, cough gently during the exhale, but make sure not to let the balloon slip out. Aim to do this 3 to 5 times. Take a moment to ease into the final relaxation. Relaxation. Now comes the favourite part of the practice. You can leave the balloon inserted to better feel the relaxation of the muscles, or you can deflate it and remove it gently. Just don't let it slip out while still inflated. This could cause injury. Let your breath flow, lie on your side, and curl up in a cozy position. Rest your head comfortably on a pillow. Imagine your entire pelvic floor blooming outward like a flower with each inhale. On the exhale, don't squeeze the balloon anymore. With the next inhale, the pelvic floor expands again. Repeat these breath cycles at least 30 times to allow a gentle release after your session. Inhale, exhale. Inhale, exhale. Removing the balloon. If you didn't remove the balloon before the relaxation, you can do it now. Deflate it fully, relax your pelvic floor on the inhale, take hold of the neck and slowly pull it out. Your Aniball INCO session for today is complete. Some days training might feel harder than others, but we believe that every first step matters, and even small ones can lead to positive change. Thank you for trusting us and letting us support you on your journey. If you have any questions or you just want to be sure you're practicing correctly, write to us at hello@aniball.eu. We're here for you and happy to help.